Okay, good afternoon, everybody. Welcome to It's Worth a Shot. Today we're going to go over some NHSN and now what do you do with it? So the information that you've generated. We've got a couple outside speakers today that are going to present with Kyla, so we hope you guys enjoy. Next slide, please. So as always, if we have third-party presenters on It's Worth a Shot, it doesn't mean that we endorse or recommend any of the information shared shared as Mountain Pacific, but we do like to make sure that everybody has a chance to present and share their views. Next slide, please. All right, we have a couple of slides of updates and reminders. We did want to share that the Children Mental Health Bureau Services is going to have a refresher training course. This is put on by the Montana Department of Health, so it's kind of geared more towards our Montana partners. But I assume that if others want to join just to listen into the information, it wouldn't be frowned upon. But it might not be as relevant to other states as it will be to Montana. So next slide. All right, we did also want to make sure we push this out on a couple of our listservs, and you might have gotten the emails directly from CDC, but there is a webinar coming up saying that is about overcoming the COVID-19 vaccine payment challenges. Having pulled a lot of our nursing homes, and especially with the reset of the up-to-date for residents with their COVID vaccines, one of the big barriers that we're running across is the payment for it and how it's reimbursed and whatnot. So we do encourage you to go ahead and sign up for this webinar. It is on the 30th, so it will be next Thursday. We want to make sure that you guys all have the ability to listen in because it is capped at 3,000 registrants. So we do encourage you to sign up for that. We also have the Healthcare Facility Extreme Weather Resilience and Mitigation webinar. Not quite sure who that's put on by, but it is on June 5th. And so if that's something you might be interested in, we've got the registration link down there for you as well. Next slide. We did want to draw attention to the infection prevention office hours that we have across the states that we work in. I did want to let you know that Alaska's infection prevention, which is AKPN, that's every other Thursday. So the next one is actually going to be on the 23rd at 11 o'clock Alaska time. And if you have not joined or registered yet, please contact Rebecca or myself and we'll get you signed up. For Hawaii, theirs is called HPN or HIPN, and you can contact Jolene, and they are every third Tuesday of the month at 11 a.m. So again, our Hawaii participants, if you have not registered, please sign up, or if you know an IP that you think should be joining, then go ahead and pass that information along. And then for Montana, they have a bi-monthly infection prevention open office hours, and that's every Tuesday at 12. And again, you can contact Pam, or you can contact Erica or Marcy Gallagher. Looks like they also have weekly infection prevention educations on Thursdays as well. So there's a couple more offerings there in Montana. And finally for Wyoming, every other week on Thursday at 10 a.m., you can contact Callie Perkins if you need registrations for that. Next slide, please. Okay, so for housekeeping items, just to let you know that we do have this webinar every Wednesday, and we do look forward to any recommendations or suggestions from you guys on topics that can be covered. So if you pop those in the chat, we'd really appreciate it. We also would appreciate it if you fill out the survey that Mary pops in chat as well, because that does help guide us on, again, topics or areas that we might need to work on or what we're doing well. So we also appreciate that. And then we do have one polling question for everybody today. So we'll get Mary to populate that for us. Do you share quality measures, quality improvement reports with residents and patients, family, staff, all of the above, or none of the above? And if you share it with somebody else that we might not have thought of, go ahead and put that in chat as well. Give it a couple moments here to answer. So we've got 7 of 37. We're at 10, that's great. See if we can get a couple more, get us up to 20. Any more takers on the quiz? Well, polling question. No wrong answers here. All right, let's go ahead and end that poll, Mary. Sorry, my dog. Okay. Looks like we've got a pretty good spread here, but mostly staff, which is good. All right, let me go ahead and pass it over to Kyla now to kick off the presentation part.
Hi, everybody. Thanks for joining today. This is our last in a series of 5 sessions, I guess, that's focused on inputting and using AU and AR data in NHSN. And so today, to kind of give us a level set on why we're doing this, why we're collecting data, and why it's important for antimicrobial stewardship, I have Anna Frick from the state of Alaska, epidemiology, and she is going to talk to us with a few slides today. I'll turn it over to you, Anna.
Sounds good. You've got my slides, right, Kyla?
Yep. Are you seeing them?
I do. Sorry, you could go
Okay.
ahead and hit the
Yep.
next one. Awesome, thanks. So we talked in our series here about the AU and AR module reporting requirements. You know, we talked a lot about the details of sort of how you have to do this and what it means to participate in those measures. And when we were talking about how we should wrap this up and how we should talk about using these data, we thought it might make sense to take a step back and sort of talk about and take a look at the big picture again of sort of what the whole deal is here. So the reason that these requirements are coming into existence is because we have this core problem where multi-drug resistant organisms are a problem. They're bad for patients, they're problematic for facilities, and they're also problematic for society because they result in people being more sick, harder to treat, more expensive to treat, sick for longer, et cetera, et cetera. And so because this problem has aspects that take place at all those different scales, we have to fix it and also monitor it at all those scales as well. Could you go to the next slide, please? So when we're in public health, the first thing we do when we see a problem is we try to quantify that problem and describe it. In order to do that, one of the first things we look at to quantify and describe the problem of MDROs is to look at antibiotic resistance data. So that also has multiple levels, right? We have the specific test of the isolate that a patient has. So when someone is sick, we figure out what that pathogen is and what it is or is not susceptible to. And then we also have known phenotypes that are problems for us that we're interested in. So those are things like a current hot topic is the carbapenem-resistant Pseudomonas, carbapenem-resistant Acinetobacter, carbapenem-resistant Enterobacterales. And there are also other multi-drug resistant organisms that come up sometimes, you know, like in the food industry, there are a lot of concerns about drug-resistant salmonellas and things like that. And so for those specific problems, we have sort of surveillance that's targeted around recognizing and identifying those cases. And then the third kind of data that we're generally looking at is the idea of sort of aggregated antimicrobial susceptibility testing data for general surveillance. And that's things that are loosely shaped like antibiograms that describe for us the general trends in how susceptibility is going across different drug bug combinations. And the antibiotic resistance module in NHSN is one way of looking at those targeted surveillance and also aggregate data problems. It's not the only way, but it is one way of doing that. And it's a way that feeds into a data system that exists so that state and federal authorities are able to see that aggregated data at the large scale. And that's one way that CDC is able to sort of access those data in a way that's relatively efficient and also consistent. Okay, so that's one aspect. All right, can we go to the next slide? Now, we can't just count the problem itself, right? We also have to think about like what is contributing to making this problem larger or smaller. So there obviously one thing that we care a lot about is infection control, which isn't like super a part of this conversation today. But another thing that we are talking about is antibiotic use, because we know that antibiotic use contributes to the problem of antibiotic resistance in a couple ways. But primarily the important one is that it provides this evolutionary selective pressure And that pressure is active at all three of our scales as well, right? When a person is taking antibiotics, that influences the bacteria that live in their microbiome to change and to be either live or die or evolve based on that pressure. Similarly, the presence and patterns of use at a facility also affect what's common in that facility. And likewise in society, right? That's why you see all these efforts at controlling antibiotic use in like agriculture so that we can prevent large scale changes in susceptibility in that way. Next slide, please. So in order to monitor this antibiotic use component, we're also going to have to collect antibiotic use data. There are lots and lots of different kinds of antibiotic use data that we could be interested in. A lot of the most interesting one, and the one that's sort of most obviously actionable, is the appropriateness data. So that's the idea of like how often and in what situations are we providing the right antibiotic for the right amount of time to the right patient. But that data isn't really a part of NHSN at this time. Hopefully it will be in the future. That data is generally speaking pretty hard to collect. However, we can also look at antibiotic use data in other ways. So we can look at process measure data. So that's, you know, are we getting indications? Is a duration included in all of our antibiotic prescriptions, stuff like that. And we can also track bulk use data. So we can just say, like, how many doses did we give out? How many patient days of antibiotic use did we have? And those are things that the AU module is able to collect. And similarly, it's not the only way of looking at this. There are many, many ways of looking at this, but it is one way, and it is a way that comes with this infrastructure that lets that data get scaled up for, you know, national level response. So that is one way of looking at it. Did I have one more slide after this? I think maybe I do. Can't remember.
I think you had one more.
Okay, cool. Can we go to the next one? Oh, never mind.
Nope.
It's not terribly important. The moral of the story, I guess, is that you don't have to use the data that is collected by the AU and AR modules. You don't have to use the reporting options or the analysis processes that are included in NHSN for that data. It's just one way of looking at things. What's important to remember is that like that is an option, and that CDC and CMS are asking for those data because it's part of this much larger picture of how we're going to handle the overall problem of MDROs. And that's how I think about this, is that this is sort of one angle on a very large and very complicated problem, and that's sort of what it's there for. If those metrics work for you, sweet, you can use them. If they don't work for you, also sweet, you can use whichever one works best for your facility. You just have to remember that this is part of a larger thing. And also, it's probably worth noticing that this is already a pretty big map, and it's probably going to get bigger because the problem of MDROs continues to exist. And so we should assume that there will be more requirements being added that will fit into this sort of mental map of the situation in the future. Okay, I think that's all I have to say, Kyla. If anybody has questions.
Very well stated. Thank you so much. Does anybody have questions for Anna at all? Okay. Well, we will move on to the next slide. And I have several other guests here today. If you have attended these sessions in the past, we did kind of like a discussion panel, just kind of talking about some of the factors that are contributing to folks getting up to speed with entering this data and looking at this data. So I've got Katie Presser and Shauna King and Tori Dahl. And so I guess I'll start with you, Katie. And I believe you were going to share the SAR data with us so that we can kind of understand what that looks like.
Yes, sorry, my screen is trying to actively die on me, so just give me a little bit of grace.
No worries.
Okay. So hopefully you can see the correct screen now. And so this is what NHSN looks like. So I just wanted to give a snapshot of what all you can get out of NHSN. So it is an abundance of data you can get out. This is inpatient only data. So it's something to keep in mind. The antimicrobial resistance, you can report emergency department cultures in there, but the use data is going to be your inpatient locations. So just something to tuck away in the back of your mind when you're thinking about how this will roll out. But let me just show you all of the reports that you can generate. And so this is why it is overwhelming when you first log on to NHSN and you're like, I don't even know where to start. Click through everything. Click through, see what things work best for you, because what works best for me isn't going to work best for everybody. So just keep in mind, I might like something that you don't like. You might like something that I don't like. Every institution is going to have a different thing that works best for them. One of the things to keep in mind too, as you go through, you can see different baseline years. So 2017, 2018, neonatal was added after the adult and pediatrics. So that's why they have a newer baseline. They are redoing right now. I think 2022 is the year that they're going for the baseline, but there's going to be a new baseline. So make sure when you're comparing your data too, you're comparing the same baselines so that you're getting apples to apples instead of apples to oranges. For the targeted or task reports, this is what NHSN will pick up and say, here's areas for opportunity for you. So they will give you feedback saying, we've gone through your data. We've used our AI sources to tell you this is where we think you should focus. So it's nice to have those if you're trying to find a place to start. It's a nice place to start. And then you can see here, you stated that is the old 2014 baseline. So old. So make sure you're using the newest baseline when you're doing your data. And then resistance data, if you are only doing inpatient, it will generate an antibiogram for you. So that is a nice piece. We have outpatient as a large portion of our campus, so it's not helpful for us for the antibiogram. But if you need help generating an antibiogram and you're only inpatient, it's a great place to start. And so I just want to give you an example of the SAR report to show you what it looks like. So this is what it looks like. For me, this is helpful when Joint Commission comes. I have something I can give them. It has a nice trend. It's easy to interpret. One is the goal you want to be at or below, and you can quickly see where we land in those months. If you're above one, again, it's not measuring appropriateness like Anna said. So it doesn't mean you're necessarily doing anything bad. There's a lot that goes into it. Maybe you had a lot of prophylactic patients that month. Maybe you didn't have a lot of patients that month and the one patient you had was on antibiotics. So there's a lot of things that factor into it. So that's why it's important to not just use this, but make sure you have like what happened. We were undergoing construction. Half of the units were closed. We only had half of our beds. You just kind of know what was happening those months, but you can overall see a trend going on there. And so it's a nice like graph that just shows very clearly what is happening in your institution when any of your regulatory bodies come. So those were the ones I was going to point out to you. So I will stop sharing now and hand it back over.
Awesome. Thank you, Katie. Does anybody have questions for Katie? So I will let Shauna, if you have anything additional to add, or Tori, if you have anything additional to add, feel free. I do see Anna.
Looks like you do have, yep, there you go. I was just gonna call that out too, Kyla, you're on top of it.
Hi, I put my question in the chat, but I was wondering if Mountain Pacific offers like a NHSN walkthrough or checkup with facilities. I'm the only IP at my really small critical access hospital, and my biggest fear is that I've been neglecting a report for 4 years and we've just flown under the radar. And I would love the opportunity, if possible, to meet with the person instead of the NHSN training videos to kind of walk through our NHSN and what I'm reporting every week and every month and annually and all of that, just to make sure I'm not missing anything. And then the running the right reports is still mind-boggling to me. And I was just wondering if Mountain Pacific offers that service.
So I would say, I'm not sure exactly who at Mountain Pacific could do that. I don't know, Anna, if that's anything that you can provide or that the folks in the other states, EPI, can provide that.
Yes,
will.
we probably can. Most states are expected to provide NHSN technical assistance to hospitals in our jurisdiction. So other Anna, feel free, we can chat. I'm sure we can come up with something that will help.
Oh, that's great. I
Looks like
appreciate
Tori
that.
jumped in and said that she can help the Montana facilities.
Yeah. Yeah, thank you, Tori. That's great.
So yeah, we'll definitely get back to you with make sure you get some one-on-one training. Maybe outside of Alaska if we can't set you up with somebody in Alaska, but I mean NHSN is NHSN, so we will definitely put you guys in contact with some one-on-one training.
Well, and just so everybody knows, we did do a polling question at our last session, and folks are interested in continuing this conversation via like an open office hours forum. And so Mountain Pacific is in process of planning that, and that will probably start next month. So that'll be another way that you can connect and ask questions and just kind of, as you walk through the process, if you're at different levels, network with other folks. And then the last thing that I wanted to mention, and Tori, thank you for providing this, is understanding exemptions. There was a CDC open office hours, which I just put in chat, that does address some of those questions about understanding exemptions, because it sounds like folks have had a lot of questions about if they are exempt or not. So I will open up the floor. If anybody else has any comments, questions. I don't know if Shauna or Tori, if you have any last minute thoughts. Not to put you on the spot or anything.
This is Shauna. No, I don't have anything else to add.
Okay.
I don't think I have anything else either. Just if you are in the process of registering through NHSN for the AUR module and you've done it and then you realize, hey, I don't have my vendor, I don't have the files ready, don't worry. When they send you that email requesting the files for verification, you can respond to that email and let them know where you are with that process. And they just request that you continue to email them at least once per month until you have those files ready to send to them.
Okay, that's great. Thank you, Tori.
And Kyla, just to jump in again, from our small group discussion, Anna Frick did point out a really good point for the exemptions. If you are exempt, but you are able to submit one portion of the data, don't feel like you can't submit data. So initially, we only submitted our use data because our resistance wasn't feeding incorrectly. So you can do just one part of it, and it might be beneficial for that data to come back to you in just that one part. And going forward, way down the line, it might break up to be just AU versus AR versus the whole thing together. Understanding that some places are always going to have send out labs, but that use data is going to be beneficial to that big picture like Anna was talking about. So don't feel like just because you have an exemption right now, you're forever exempt either.
I would say it's like quite likely in the next couple years, the AU and AR reporting requirement will be separated from AUR into AU and AR, in which case having an exemption for one won't give you an auto exemption for the other. So you should, if there's one you can do, you might as well get started.
All right, thank you, ladies. Well, it looks like we've got about 5 minutes left. I believe on the last slide, I posted the FAQs for both the AU and the AR modules. There is a lot of information there as well, so feel free to check that out. And if nobody has any ending comments or questions, we can wrap up just a little bit early. Thank you for being with us today. Appreciate your participation.
So our
And-
next It's Worth a Shot is actually going to be brought to us by the Stroke Coalition of Alaska. So that's what we have set up for next week. Kevin
thanks.
Myrick, yep, Director of Trauma and Comprehensive Stroke Center at Alaska Regional Hospital, will be presenting for us. So that should be a good one. And again, if you can remember to fill out the survey that's in the chat, we'd really appreciate it. We do take what you say to heart. And you guys all have a great Wednesday. Thank you so much.
Thanks, everybody. Have a good day.